Do you frequently feel like your bones ache more than usual? Or maybe one leg feels shorter than the other? Or have you noticed that your hat doesn't fit anymore because your head shape changed? These might sound strange, but they can be signs of something called Paget's disease of bone. This condition isn't about your heart or muscles, it's about how your bones renew themselves. Normally, your body constantly replaces old bone with new bone, like repainting a house every few years to keep it strong. But in Paget's disease, that repair process goes into overdrive, causing bones to grow too large, weak, or misshapen. It often happens slowly and without warning, mostly in people over 50. The good news, it's not cancer, and it can be managed well if caught early. Great question. Scientists aren't 100% sure, but they think it's a mix of your genes and your environment. Imagine your body has a team of workers rebuilding a road. In Paget's, one of the workers, a cell called an osteoclast, starts removing old bone too aggressively. And then the next team, with osteoblasts, builds new bone too fast and in a messy way. It's like paving a road with broken bricks and cement chunks. It's bumpy and weak. Some people inherit a higher chance of this happening, especially if a parent had it. Also, some researchers believe certain viruses, like a long-ago measles-type infection in bone cells, might trigger it in people who are already at risk. So yes, your DNA and maybe a hidden virus could be playing a secret role in your bone health. How do you know if you might have this? Well, many people don't feel anything at first, it's sneaky. But over time, some clues pop up. Have you or someone you know started walking with a limp, not due to an injury? Or maybe pain in the hips, lower back, or legs that doesn't go away with rest? Some people notice their bones feel warm to the touch, or their hat size increases. That's because the skull can thicken. Others might get hearing loss if the bones near the ear change shape. In rare cases, the heart has to work harder to pump blood because too many blood vessels grow in the messed up bones. So yes, bone disease can actually make your heart strain. If you feel unexplained bone pain, swelling, or even fractures from small falls, it might be worth asking your doctor about your bone health. First, your doctor might order a simple blood test. A high level of something called alkaline phosphatase can be a red flag. It's a sign your bones are rebuilding too fast. Then an X-ray can show mosaic patterns or thick, crooked bones, like a tree that grew too fast and bent to one side. A bone scan, where you get a small amount of safe dye, helps spot which bones are overly active. They light up like hot spots on a map. Once diagnosed, treatment can start. The main tools are medicines called bisphosphonates. They calm down the overactive bone cells, kind of like putting the brakes on a speeder. These can be pills or IV infusions. If bones are seriously deformed or pressing on nerves, surgery might help. Most people feel much better after treatment, with less pain and stronger bones. The goal: stop damage before it gets worse. Can we stop it before it starts? Sadly, we can't yet prevent Paget's disease completely, because we can't change our genes or undo old infections. But we can catch it early. If a family member has it, talk to your doctor. A simple blood test during a regular checkup can help find it early, like checking the smoke alarm before there's a fire. Also, staying active and eating a healthy diet with enough calcium and vitamin D keeps all your bones strong, even if you're at risk. Think of it like putting good fuel in your car. You're not stopping mechanical issues entirely, but you're reducing wear and tear. So yes, while you can't always prevent Paget's, you can give your bones the best chance to stay healthy. What's new in science? Exciting stuff. Researchers are digging deeper into the genes linked to Paget's, especially one called SQ-STM1. By studying families with the disease, they're learning how broken signals in bone cells lead to chaos. Newer drugs are being tested that target specific parts of the overactive repair process, like smarter brakes for bone cells. Some studies are looking at whether anti-inflammatory drugs or new biologic therapies could help. There's even research on using stem cells or gene editing in the future, though that's still early. Also, doctors are learning that managing Pagets well can prevent complications like arthritis or hearing loss. So while it's not cured yet, every year brings us closer to better control and maybe one day, prevention.